Hello, my name is Dr. Kleef. I'm a medical doctor who did his training in Germany and Vienna, London and United States. I am head and founder of the Institute of Integrative Oncology in Vienna, Austria. We are seeing here a wide array of different patients with cancer illnesses. In the center of our medical purposes is hyperthermia and immunotherapy. We will show this later on. We believe that cancer is such a complex phenomenon, attaching more and more people worldwide, that we need a truly integrative approach, bringing together the best of all different sciences, such as the classical chemotherapy, radiation and surgery approach, but also integrating new avenues such as molecular biology, psychoimmunology, nutrition, psychology, meditation, prayer, sports. All that plays an enormous role in the conquest of cancer and how patients can ultimately, hopefully, fight this disease. We have a team of different doctors here, specialized in different specialities, and we believe that there is not one cancer cure, but we believe that we have to find for each and every patient the individual best therapy suited for him, which way to go. This includes, of course, a very important cooperation with our partner Professor Boyer in Düsseldorf, who is an expert and world expert in analyzing tumor specimens on the gene array analysis, on different molecular mappings to describe tumors. He's a specialist in identifying circulating tumor cells. We also have a long-standing experience with Professor Boyer on the analysis of chemosensitivity testing, which I believe it will be the future of medicine, where we test in vitro before we apply chemotherapies, how effective they might be. Interestingly, it not only includes classical chemotherapies, but also substances like high-dose vitamin C and alpha-lipoic acid, or artesunate or dichloroacetate, or different new molecules which actually have much less side effects. And interestingly, in many cases we see that these more natural substances can be very effective. I also want to mention taurolidine in this respect. I would like to take you on a quick tour through our institute so you can see what this is all about. We start the quick tour with our yoga and meditation room. We believe that yoga and meditation is an extremely important support for the spiritual part of the healing. The will to survive is clearly supported by meditation and breathing techniques which we teach our patients. Okay, here you see our colonic cleansing. We believe that colon hydrotherapy in the combination with infrared heat therapy is a very important way to support the organism in detoxification. After we support the organism in detoxification, we provide patients with very specially yogurts which contain 42 different living strains of special yogurt bacteria. In the beginning, there was a word in the Bible. We believe that listening to our patients and giving them the chance to express their feelings plays an enormous role in the ultimate outcome of the cancer healing journey. And we believe that the will to survive can only be achieved by looking at the belief systems of the patient, and we help the patients to understand themselves in this crisis. Okay, now we are at the whole body hyperthermia. This is a device which works with water filtered infrared radiation. I am showing how the infrared rays are being generated, which gently heat up the patient to a fever temperature. and this has a multitude of physiological and immunological effects. It helps very much to activate the immune system on the one hand and also to increase the efficacy and the reduction of side effects of chemotherapy. It also has very beneficial effects on the overall physical status and on the emotional mood. Now you see our infusion facilities in the center now, our device for ozone therapy, which is very well known as an enhancer of overall vitality and stimulating the immune system, specifically natural killer cells. What we see now is a very special device designed for prostate hyperthermia. With this device we insert a special catheter into the bladder and heat the prostate from inside. This is a very promising method in combination with other therapeutic approaches to treat not only prostate cancer but also very successfully prostatitis and benign prostate hyperthermia. Now we are in the intensive care unit where we perform long duration, moderate whole body hyperthermia. This is a technique in which we have excelled since 15 years. Our team is probably one of the most experienced in the whole world. We have done thousands of these treatments and it has proven to be extremely safe and very, very promising. Normally what we do is we advise patients to have the chemotherapy on day 1, followed by long duration whole body hyperthermia in day 2. Here you see the devices which are working with water filtered infrared radiation. You now see a local regional deep hyperthermia aiming at generating heat in the depths of the body, and for this we use a sandwich technique where we take large electrodes which are water cooled. It's very important to protect the skin, and we place the electrodes on the front and the bottom of the patients. We have different sizes available, and importantly is that we can achieve temperatures in the depth of the tissue which are sufficient to not only induce tumor cell killing but also in the fight against cancer. We continue with local regional hyperthermia. Here again you see the control devices for the local regional hyperthermia, which is here displayed on the right hand side. Yet again you see another device for local regional hyperthermia, and this is the device which achieves temperatures by radio frequencies in the depth of the tissue. This device we tend to use more for tumors with superficial origin. With this device we are measuring the energy status of the human being, analyzing the sympathicus and the parasympathicus by a skin sweat analysis, and very interestingly we have found out that epithelial cancers and sarcomas have a very distinct pattern in whether they are vagotonic or sympathicotonic, and we determine whether patients get ionized oxygen positively or negatively charged based on this analysis. Yes, thanks for staying with us for this small tour. In summary, I would like to conclude that I believe that the future of cancer therapy and cancer immunotherapy will be targeted therapy. We need to identify the molecular targets and the immunological targets on the cancer cells and in the cancer environment of the individual patient to decide what is the best route to go. This is no question that with a new thinking which is taking place now in molecular biology, we will find therapies which will be much more effective and which will harm the patient much less, as this is the case nowadays. I believe that the best of our efforts in the one aim which unites us all, then this is to be the partner on the healing journey of the patient, will be successful one day. Thank you very much.